Why do vulnerable people get recurrent pneumonia infections? Recurrent pneumonia can be a frustrating experience, especially for those with underlying health issues. It often happens because certain factors weaken the body's defenses, making it easier for infections to keep coming back. When the immune system is not functioning optimally, it cannot effectively fight off bacteria or viruses that cause pneumonia. This is common in the very young, the elderly, or people with chronic illnesses like diabetes, asthma, or heart failure. These conditions can impair immune responses, leaving the lungs more vulnerable to repeated infections. Chronic lung diseases such as chronic bronchitis, chronic obstructive pulmonary disease, or bronchiectasis also play a big role. These conditions damage lung tissue or impair the normal clearing of mucus and pathogens from the airways. When the lungs cannot clear out bacteria or viruses efficiently, it creates a perfect environment for recurrent infections. Structural abnormalities in the airways, whether from birth or injury, can further hinder normal lung function and increase the risk. Older adults or those with reduced mobility may have trouble swallowing properly, which can lead to aspiration. Aspiration occurs when food, saliva, or stomach contents accidentally enter the lungs, causing inflammation and infection. This process can happen repeatedly in frail individuals, leading to multiple episodes of pneumonia. Poor nutritional status also contributes, as low body weight and muscle loss weaken respiratory muscles and impair immune responses, making it harder for the body to recover from infections. Environmental factors like smoking, exposure to air pollution, crowded living spaces, and poor dental hygiene can also increase the chances of developing pneumonia again. These factors can introduce or promote bacteria and viruses that cause lung infections. If someone has had pneumonia before, their lungs may have some lasting damage or persistent bacteria that make future infections more likely. Certain medications can influence this risk too. Inhaled corticosteroids, often used for asthma or COPD, can suppress local immunity in the lungs. Similarly, drugs that reduce stomach acid may alter the natural bacteria balance in the digestive tract, which can sometimes lead to increased risk of lung infections. Influenza plays a significant role in this process. When someone with a weakened immune system catches the flu, it can damage the lining of the respiratory tract and impair immune defenses. This damage makes it easier for bacteria to invade and cause pneumonia. Sometimes, bacteria that normally live harmlessly in the nose or throat can take advantage of this weakened state and cause secondary infections, leading to recurrent pneumonia. In summary, vulnerable individuals are more prone to repeated pneumonia because of a mix of weakened immune defenses, chronic lung conditions, difficulties with swallowing or mobility, nutritional deficiencies, environmental exposures, and previous lung damage. Vaccinations against influenza and pneumonia, managing chronic illnesses, improving nutrition, and avoiding risk factors are all important steps to reduce the chances of recurrent infections. Always consult healthcare professionals for personalized advice and treatment options tailored to individual health needs.